deadly coronavirus.
A new type of viral pneumonia.
The nation has just declared that this is a pandemic.
With COVID-19 ravaging the world, people are desperate to understand what caused the outbreak so we can prevent it from happening again. The leading theory is that the novel coronavirus first crossed over to humans from wild animals being killed and sold at a live animal market in Wuhan, China. These animal-borne illnesses are known as zoonotic diseases, and the CDC claims 3 out of every 4 new or emerging infectious diseases in people come from animals. Wildlife consumption is not unique to China, but in response to the coronavirus outbreak and immense public pressure, the country has taken the important step to ban the trade and consumption of terrestrial wildlife. The list of animals that cannot be sold as food also includes cats and dogs, which had been killed at a rate of 10 to 20 million per year in China alone. Though the ban is a step forward in the continued effort to protect wildlife and avoid new disease outbreaks, there is still a significant risk that enforcement may not be effective enough to prevent underground sales. The new amendment also makes exemptions for non-edible uses such as scientific research, medical use, and display of wild animals, and provides a plausible cover for those looking to sell wild animals illegally. Wet markets are markets of any kind selling fresh animal meat and other perishable goods. Live animals are frequently kept in cages and killed for the customer upon purchase. The concern with these kind of markets is that live animals are often kept alongside a wide variety of species in cruel conditions that keep them weak and vulnerable to illnesses. This allows viruses and bacteria to evolve and spread between species and eventually infect humans. Wet markets were closed as part of the coronavirus lockdown, but they have reopened in parts of China as early as March 27th and appear to be operating in much the same way as they had previously been. The decision to reopen wet markets in China has been met with criticism from U.S. media and politicians. New Jersey Senator Cory Booker spearheaded a letter with over 60 other bipartisan lawmakers urging the WHO to condemn these markets. And Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, condemned the practice.
It boggles my mind how when we have so many diseases that emanate out of that unusual human-animal interface, that we don't just shut it down.
Even with these efforts, the WHO has defended the reopening of live animal markets. Wet markets are not unique to Asia. Live animal markets are a global concern and have long operated in countries around the world. Counts from 2015 indicated that at least 80 live poultry markets were in operation in New York City alone. Live animal markets, wherever they are in the world, contain stressed, sick animals caged in close proximity, in a practice that offers the ideal breeding ground for deadly pathogens. As long as these markets are operating, and as long as we're consuming wildlife, we are at risk for another, possibly worse pandemic. Act now. Urge the World Health Organization to call for an international ban on live animal markets.